Hello, everyone. My name is Lori Peak, and I am the Principal Investigator of the National Science Foundation-supported CONVERGE initiative, which is headquartered here at the Natural Hazard Center at the University of Colorado Boulder. CONVERGE is dedicated to advancing ethical, coordinated, and scientifically rigorous hazards and disaster research through providing training resources and connecting researchers across disciplines. On behalf of the entire team, it is our pleasure to welcome you to the CONVERGE webinar series. Today, during this brief 30-minute demonstration webinar, we are going to share the second CONVERGE training module, which focuses on the topic of disaster mental health. We are so grateful that you have joined us today. Before we launch into the demonstration, please know that this webinar is being recorded. The captioned recording and slides will be posted on the CONVERGE website at converge.colorado.edu/communications. Should you have any questions or comments during the webinar, please use the Q&A box or the chat box. If we are unable to respond during this brief webinar, we will post written responses on the CONVERGE webinar page for this session. One of the major tasks of the CONVERGE project is to accelerate the training of a diverse next generation of hazards and disaster researchers and practitioners. We recognize that disaster research is often highly event-driven. In order for the field to progress, it is crucial that those new to this area of study have access to already existing research and an understanding of various methodological approaches and potential ethical challenges. To that end, our CONVERGE research team is creating a series of free online training modules that are specifically designed for students, emerging researchers and practitioners, and others new to the field who hope to quickly background themselves on key information. This means that these training modules can be used as a class assignment or other competency requirement to ensure that researchers and practitioners have sufficient knowledge and skills to conduct work that is coordinated, comprehensive, ethically grounded, methodologically sound, and scientifically rigorous. Thus far, we have released 2 modules, the Social Vulnerability and Disasters module and the Disaster Mental Health module that you will hear more about today. But this spring of 2020, we will be releasing a number of other modules focused on a range of topics, including cultural competence in hazards and disaster research, institutional review board procedures for hazards and disaster researchers, and conducting emotionally challenging research. We are also working on other modules related to research ethics, social science and interdisciplinary methods, and best practices for publishing and ethically sharing data and findings. Over the coming years, we will continue to offer individual certificates for each of these modules, while also building toward a credentialing system for hazards and disaster researchers and practitioners to help ensure a minimum competence in the field and to democratize access to information through providing these free resources. You will hear today from Rachel Adams, who is a postdoctoral research associate at the Natural Hazard Center and with the CONVERGE initiative, and the lead developer for the CONVERGE training modules. Candace Evans, who is a graduate research assistant at the center and for CONVERGE and co-lead developer, as well as a PhD student in sociology, will also be presenting. Rachel and Candace have worked for months with the team here to create, test, and share the Disaster Mental Health Training module, and they will be providing an overview and interactive demonstration. The hope is that after you have seen this module, you might consider using this in your own classroom, research lab, or other professional setting. This training module was made possible through an award from the National Science Foundation, Division of Civil, Mechanical, and Manufacturing Innovation program on humans, disasters, and the built environment, with supplemental support from the Centers for Disease Control and Prevention. Candace, Rachel, and I especially want to thank Tracy Thomas and her colleague Amy Wolkin at the CDC. Tracy and Amy have served as full partners in this effort, and they have worked with us for months to ensure that the content of this training module is empirically rigorous and relevant to a wide audience. Tracy is going to share a few words now regarding the CDC support for this module and how we hope it may be used. Tracy?
Thank you, Lori. Hello, everyone. As Lori said, my name is Tracy Thomas, and I am so pleased to welcome you to this webinar. Lori asked that I take a few minutes to introduce you to what we do within the Center for Preparedness and Response, or commonly referred to as CPR, while also sharing a few words about why we were interested in supporting the development of this CONVERGE training module with the Natural Hazards Center. CPR's mission is to protect Americans by advancing public health preparedness and response capabilities both at home and abroad. In large part, that mission is supported by promoting and fostering science and innovation that can be applied to enhancing readiness. Additionally, enhancing readiness is accomplished by building the next generation of public health professionals and tools for preparedness and response. And that's exactly what the development of the Disaster Mental Health Training Module, as well as the previously released Social Vulnerability and Disaster Module supports. Particularly, the Disaster Mental Health Module summarizes decades of research while also offering practical recommendations for advancing research and practice in this space. The module ends by providing 10 key areas where more research is needed, as well as highlighting application of useful tools and resources of what is already available. We are so grateful for your interest in this module, and our sincere hope is that it will be used by students, researchers, practitioners, and policymakers to help advance disaster mental health research, as well as improve practical applications. With that, I'm going to turn it over to Candace Evans. She worked extensively on this project, and so I hope you would join me in offering her a virtual welcome.
Thank you so much for the introduction. As Tracy mentioned, my name is Candace Evans, and I am a graduate research assistant here at the Natural Hazards Center and as part of the CONVERGE initiative. Over the past 9 months, I have been working on reviewing the literature and developing a number of the case studies that appear in this module. Today, I'm going to start by providing an overview of the Disaster Mental Health Training Module. Before I begin, though, I want to acknowledge that this is a lot of text you are seeing here, so I want to first take a moment to orient you. What you can see right now is that the Disaster Mental Health Training Module is organized into 4 lessons: background, methodological approaches, knowledge to action, and future directions. Within each of these lessons are different topics, which present interactive information that aims to achieve a specific set of learning objectives. By the end of this module, participants should be able to describe specific mental health outcomes that may emerge in the aftermath of a disaster or emergency, understand the conditions and risk factors that exist before, during, and after disaster that can influence mental health outcomes with an emphasis on the United States. Identify potentially vulnerable populations that may be at greater risk for poor mental health outcomes in the aftermath of a disaster with an emphasis on the United States. Explain the primary methodological approaches to studying disaster mental health. Understand the importance of the ethical conduct of research in disaster mental health. Recognize how studying disaster mental health improves hazards in disaster practice and policy. Understand how research on disaster mental health can positively improve population outcomes. Recognize future directions for disaster mental health research, and learn about additional resources that support disaster mental health research. You can see now that on the right-hand side of the page, there's a tracking bar where you can track your progress as you move through the module lessons and topics. Once you have completed a topic, you can always go back and review at a later time. Throughout the module, we provide several real-life examples and case studies to illustrate content, For instance, in the background lesson, we examine risk factors during a disaster that shape mental health outcomes among rescue and recovery workers. The end of this section also concludes with a flowchart, which you can see on this slide here, that illustrates how certain factors present before, during, and after a disaster and influence mental health outcomes. In addition to the module's written and interactive visual content, we have compiled a list of additional resources relevant to conducting disaster mental health research. Within the Resources tab at the top right corner hand of the screen, we provide links to tools and resources, public health surveys that collect data on mental health outcomes, screening tools and diagnostic measures, literature reviews, and additional web resources that you can access. These resources can help you learn more about disaster mental health and support research activities that focus on mental health outcomes in the hazards and disasters context. At the end of the module, you can take a 10-question quiz to assess what you have learned. If you're an instructor considering these for classroom use, please know that we have a quiz bank that is on a random generator. That means if you assign this to your students, they will not all get the same questions. If you get at least 8 out of the 10 questions correct, you will receive a certificate of completion with your name and the date. You can save this certificate as a PDF and can also access it at a later time via your training module login information. As Lori mentioned previously, these certificates are intended to become part of a larger credentialing system to train the next generation of hazards and disaster researchers. I am now going to turn this over to Rachel Adams. She is going to share her screen and conduct a demonstration of the CONVERGE Disaster Mental Health Training Module. While Rachel is getting her screen ready, let me remind everyone that you can register for the module at converge-training.colorado.edu/register.
Hi everyone, and thank you for that introduction, Candace. I'm now going to walk you through a demonstration of the Disaster Mental Health Training Module. This module covers a number of important topics related to disaster mental health. One lesson reviews the literature and presents background information on mental health outcomes associated with disaster. Another focuses on methods used to conduct disaster mental health research. Another examines programs and policies that aim to address mental health needs of disaster-affected populations. And the last lesson provides recommendations for future directions for research. For the sake of time, I'm just going to guide you through the knowledge to action lesson. This lesson explores advances in evidence-based action by reviewing examples of how disaster mental health research has informed public health and emergency management practice and policy. The first topic in this lesson is allocating resources. Here, the module presents an example of how disaster mental health research can help to improve the allocation of mental health care services and resources before and after a disaster. For instance, following Hurricanes Irma and Maria, many Caribbean nations experienced workforce, financial, and practical barriers to addressing their population mental health needs. In recognition of these deficiencies, the Caribbean Development Bank partnered with the Pan American Health Organization to increase mental health care capacity through enhanced training within the health sector, external agencies, and the broader community, as well as the establishment of a roster of mental health professionals who could be mobilized during an emergency. In the targeting vulnerable populations topic, the module draws on research that examines the vulnerability of children to poor mental health outcomes from disaster. For instance, the CDC has developed a number of resources to help families, caregivers, first responders, and teachers address the mental health needs of children. The Helping Children Cope During and After a Disaster fact sheet, which can be seen in the example here, acts as a resource for parents and caregivers and provides tips for reducing distress among children before, during, and after a disaster, as well as information that can help to identify symptoms of distress at different ages. The next topic is evidence-based disaster mental health interventions. The example presented here, Journey of Hope, is a curriculum that addresses the unique emotional needs of children and their caregivers after disaster. Through games, stories, and positive behaviors in a small, safe group setting, the curriculum provides children and their caregivers with the skills to build protective factors and enhance their resilience to cope with disasters. Next, the module discusses how research can guide coordinated delivery of mental health care. The topic presents the example of Reach NOLA, which is a nonprofit organization founded in the aftermath of Hurricanes Katrina and Rita that utilizes best practices identified through research to guide coordination of different mental health providers, including community health workers, case managers, therapists, primary care physicians, psychiatrists, and other clinical and non-clinical personnel. The next topic is workforce training and education. And the example presented here is the Psychological First Aid Field Guide, an evidence-informed guide for practitioners, first responders, volunteers, and other professionals responding to the immediate mental health needs of individuals exposed to disaster. Next is policies to address disaster mental health needs. Research can identify gaps in existing disaster preparedness and risk reduction strategies. This can aid policymakers in the prioritization of action areas and implementation of policy areas to address the potential mental health needs of populations affected by disaster. For instance, the Stafford Act dictates federal disaster response activities, including those delivered by FEMA. When a presidential disaster declaration is made, the short-term federal assistance is provided to support behavioral health, such as to provide professional counseling services to victims of disasters, train disaster mental health workers, or conduct research to evaluate best practices for addressing population mental health needs. Finally, we present a logic model summarizing how research leads to outcomes, which can inform practices and policies that address population mental health needs and ultimately improve disaster coping abilities, enhance resilience, lower disaster morbidity and mortality, and reduce social vulnerability and inequality. At the end of each lesson, there's a brief knowledge check, which is a 2-question quiz to make sure the user is engaged and paying attention. The knowledge check does not count towards the final quiz. For those joining you via your screen, you can see 2 multiple choice questions. The first question asks, Reach NOLA strategy utilized evidence-based practices to guide the delivery of blank. The 4 response options are money to disaster victims, shelter to disaster victims, coordinated mental health care to disaster victims, and free legal assistance to disaster victims. I'm going to press the 3rd option so that the sentence reads, Reach NOLA strategy utilized evidence-based practices to guide the delivery of coordinated mental health care to disaster victims. The second question asks, the Robert T. Stafford Disaster Relief and Emergency Assistance Act is activated after what is declared? The response options are a presidential disaster declaration, a congressional disaster declaration, a city hall disaster declaration, and an international disaster declaration. I am going to press a presidential disaster declaration. To submit my responses, I press Finish Assessment, and I now have the option to view questions to see whether I got them correct. And as you can see, both answers are correct. I wanted to point out one more thing during this demonstration. As Candace mentioned earlier, the module has a Resources tab where additional resources are listed that can support research on disaster mental health. These resources include disaster mental health tools, public health surveys, screening and diagnostic resources, literature reviews, and other web resources. The literature reviews consist of highly cited journal articles that review disaster mental health research. Each of these resources is also hyperlinked. For example, if I press the International Society for Traumatic Stress Studies, it will bring me to this resource's website. So that concludes our demonstration today. We are now going to return to the webinar slides.
Thank you so much, Rachel. We hope that this webinar has been helpful to you today. We also want to let you know that the next module we will be releasing is focused on the topic of cultural competence in hazards and disasters research. This spring, we will also complete additional models, including those focused on IRB procedures for hazards and disasters researchers and conducting emotionally challenging research. We will be hosting brief demonstration webinars like this one for each of these modules and the others that are a part of this series as they become available. A few reminders before I turn this back over to Lori to close out this session. To contact us about any questions you may have, please email us at converge@colorado.edu. To register for and access the CONVERGE training modules, please visit converge.colorado.edu/training-modules. This webinar has been recorded and will be posted on the CONVERGE website at converge.colorado.edu/communications. Lori, over to you.
Thank you so much, Candace and Rachel, for that demonstration and for all of your dedicated work. This module would not have come to life without you both and without the support of the Centers for Disease Control and Prevention and the National Science Foundation. We also want to acknowledge the entire team here at the Natural Hazard Center. Everyone has contributed to this module in some way, either through reviewing, testing, reading the material, or otherwise supporting this effort. Undergraduate research assistants, graduate research assistants, and research associates here at the center took the time to carefully review this module and provide us with detailed feedback. Rachel, Candace, and I are so grateful. We also wanted to thank all of you for taking the time to be a part of this webinar today. If you haven't already, we hope you will register for the CONVERGE training modules at converge.colorado.edu. We wanted to give you a quick update on the modules. To date, 496 people, including students, academics, government officials, private sector professionals, practitioners, and others, have registered for the training modules. Thus far, 149 have successfully completed the social vulnerability training module, and 30 have completed the disaster mental health module. We look forward to seeing your name on a completion certificate soon. Finally, before we close, we wanted to acknowledge the people in communities the world over that have been struck by disaster. Over the past several weeks, the people of Puerto Rico, who are still working tirelessly to recover from recent hurricanes, have had their lives upended again by a sequence of earthquakes. In recognition of these events, we will hold a virtual forum of the Social Science Extreme Events Research, or SSER, network later today at 2 p.m. Mountain Time. All social scientists are encouraged to join this conversation, geared toward encouraging ethical coordination and to identify pressing research questions. You can find more information at converge.colorado.edu/communications/virtual-forum. Thank you again for your support and your attention. Please contact us via email at converge@colorado.edu if you have questions, comments, or suggestions for how we can best share this module with others. Also, please know that we can update the training module if you have further resources, examples, or publications that you want to share with us. Please contact us. Please visit converge.colorado.edu/signup to receive future alerts regarding training modules and many other resources being developed by CONVERGE. Have a great day, everyone, and please take care of yourselves and others.
So I can see that there are a couple of questions from panelists. And so given that we do have a few moments left in our webinar, I was hoping that we could actually address some of those questions. So the first question is from Kelly Evans and asks, do you have best practices for animal owners or farmers? And so I'm happy to take a stab at answering this question. The focus of this specific module is on disaster mental health, and really with an emphasis on the impact and how to conduct research related to the mental health outcomes associated with disasters. And so we don't specifically focus so much on some of the complications or issues that animal owners and farmers may experience, for instance, with evacuation and being able to access locations where they can bring their animals in the event of a disaster. However, we will actually, at the Natural Hazard Center, be developing a special collection on mass sheltering through our Research Counts publication, and that will be released later in the spring. And I know that specifically this special collection of articles where we take research and provide kind of practical journal form articles with a number of tools linked throughout will specifically talk about some of the issues that animal owners and farmers encounter, as well as tools they could use to better prepare for their animals. The second question asks, hello, this is from Susan Park. Hello, I'd like to check in to see if this training module is free. I'm working on my county's hazard mitigation plan. I would like to let my jurisdictions know about this module as part of my planning process. And just to let you know, yes, all of the CONVERGE training modules are free of charge. You just need to register via the link we provided in our presentation, so that is not an issue. The third question asks, is any training available for first responders to help them recognize and cope with events occurring as part of their participation in a disaster response? And so, again, I'm going to just stress that really this training is more research oriented. However, we do provide tools and resources both throughout the module as well as in our additional resources tab that link out to available resources that are specifically geared toward first responders and the mental health needs of first responders when responding to disasters. And finally, the last question asks about how long does it take to complete each of the modules? Thanks. And this was asked by George Schwartz. And the answer to that question is it takes about 30 to 60 minutes to complete. Some people longer, some people shorter, but typically, meant to be digestible. And you can also log out and return to it via your login credentials through the CONVERGE training modules to be able to go back and continue to work on it. You don't need to finish it all in one setting. So I believe that was the last question within the Q&A. If there are additional questions, please do email us at converge@colorado.edu. We thank you again so much for participating in this webinar. Thank you.